So it's really fun to present y'all. I'm ABD. I'm a doctoral candidate, so I'm almost done, I promise. But this is a presentation that I hadn't planned to give because I got my emails mixed up and I didn't know I was going to be presenting. Actually, I'm going to stop sharing for a second. But this is a presentation that's sort of a hybrid of a couple things that I'm actually actively working on in both my dissertation, but also in the general work that I do. And you'll get a sense that I know I got to go quickly for there to be some sort of time at the end for Q&A. So I'm going to just apologize in advance that I'm going to go quick. I don't know if I need to pause recording or if we need to break that up or not. But I'll let
You're good, Matt. You're good. Just go right ahead. And I'll send you some messages with time warnings just so you can focus on whatever pace you want to go at.
I'll keep it on track, but this is a presentation that really sort of summarizes the breadth of what my dissertation and my work has been about, not just the research, but also the sort of the side part of it. I consider myself sort of a pracademic. I'm much more interested in the practice of this work than I am in the academic side of it. And part of that is just kind of, you'll see why, because there's a lot of fun stuff I get to be a part of. So I'm technically a PhD candidate at the University of Kansas School of Architecture and Design. I co-founded at the beginning of that process Dotte Agency with two other professors at KU, Niels Gore and Shannon Chris. So a lot of the work you'll see in this represents our sort of collective capacity. Dotte Agency is not a nonprofit. It's not an organization. It's just a collection of, a couple of architecture studios work in. But over the last few years, I've sort of moved on from that. I currently work as the program manager for the Health Equity Task Force at the Unified Government of Wyandotte County Health Department as a full-time employee there. And starting in January, I will be the Director of Community Development at Vibrant Health. So that's a great federally qualified health center that provides health insurance to the uninsured and underinsured here in Wyandotte County. And some of the work that I'm working on now is kind of why I'm excited to go work for them starting next year. So briefly, what I proposed presenting on was a few case studies. And so that's kind of the framework I'm working off of. But the idea is to talk about design, agency, and governance, and really how do we build community? And specifically coming from experiences I've been fortunate to be a part of in Wyandotte County. There's a few projects I call out in this abstract, which is what I submitted to present, but you'll see a lot more than that because I'm actually adapting a different presentation that I gave recently with Shannon and Niels. Actually gave it with Niels, but it reflects our work together to the Public Digital Humanities Symposium. That was a national endowed arts event that the KU Digital Humanities folks hosted earlier this summer. So there's some of this that's in that, and I've added a little bit more. But briefly, this is sort of what my dissertation is about, is sort of this idea of community health design, building up a framework where individuals in the community can help sort of shape what they want to work on, generally looking at health disparities, so sort of the motivating influence that they're addressing, and then coming up with creative, elegant solutions to the problems that they're experiencing, and doing that in a way where they own the decision-making process. And so this is not something I was taught. It's not something anybody else is taught. It's something you kind of just pick up as you go. But from where I stand, there's this sort of intersection between public health, community organizing, the design process, and then a little bit of urban planning. Now, you could argue that there's a lot more disciplines in that. That's probably true. But I feel like I've had a career or a job in each one of these disciplines, and they speak to what I'm going to present to y'all today. And that's what my dissertation focuses on. But as a little bit of background, Dotte Agency was this thing we started at the KU School of Architecture. We started because it was actually the KU Applied Behavioral Sciences folks invited us to a Latino Health for All coalition meeting where they were doing a park redesign at Bethany Park on Central Avenue. And they were doing a project, and they were telling us all this design stuff that they were doing. And we said, oh, that's cool. Who's your architect? And they said, architect? Why would we ever go to an architect? And it made us appreciate that architects only work for like the 1% of people in this world who have enough money to afford design as a service. And so we really wanted to focus on how can we provide design to community groups. And we started doing that work out of a space at 611 North 6th Street, graciously sponsored by Community Housing in Wyandotte County. And we identified the name Dotte Agency because it's this portmanteau of Wyandotte County Spatial Agency. And we started working on projects predominantly in the northeast part of Wyandotte County, but the eastern half is where our work has been over the last 8 years. It's over 86,000 people. It's over half the county's population, but it's living in a much smaller slice of the geography. And so it's an area that has, been plagued by a lot of social challenges over the years. It is very diverse, but there's also a lot of rich culture, and some of the previous presentations spoke to just how much great stuff's going on with parades, and you start thinking about food and community. It's a really vibrant community, and I'm really fortunate to consider it home since I moved here 2 years ago, because of how much I love being a part of this community and what's going on. But it's also had this, the dark history of racism embedded in its built environment through things like redlining, where the homeowner loan corporation maps, defined areas that were not able to be receiving loans to renovate homes. And that has led to a whole host of public health issues related to whether there's not enough grocery stores in your neighborhood because the homes haven't been maintained and repaired, whether there's lead in your pipes or in your paint. There's a lot of health disparities that we can look at, but it's not just redlining. It's everything else that's come since too, right? So it's where highways tore down neighborhoods. It's the lack of transportation, the lack of public housing, having what's being more frequently referred to as food apartheid. And in public health, the neighborhood and the community actually have a role to play. We look at that in the social determinants of health, that when you kind of scale back from the individual, your community affects your health, and your environmental factors matter. So that's what Dotte Agency was sort of trying to work at. And we looked at things like the Ladder of Citizen Participation from Sherry Arnstein, which is this kind of seminal urban planning text. And she was looking at model cities programs years ago and said, hey, community engagement's not enough. Like, you engage your community, you're not actually going to change the systems that are kind of oppressing people. So she said, look, at the bottom of the rung, there's non-participation. It's usually what happens to communities when something happens to them and they find out at the 11th hour and there's not enough time to really respond. There's tokenism, which is sort of this, hey, we'll have you come to the meeting, we'll tell you what's what, but we're not going to actually want your opinion. You get a couple minutes to speak up on the mic and then your turn's up. And at the top of that was citizen power. It's giving communities the chance to own the decision-making process and share and collaborate in doing that work. And somewhere up there is whether you're in partnership with a community, you have delegated power, or you actually control what's going on. And so this was like our earliest approach when we were doing stuff in Northeast KCK, working with different community groups. And pretty early on, we said, when we talk about community engagement, what do we really mean? And we actually looked to public health. And they had this framework, 9 principles of community engagement. And we kind of modified it for what we do, which is participatory design. And so this entire sort of presentation features 9 sort of mini case studies that speak to these 9 principles. And so I'll kind of go over each one briefly. And I know I'm going to be short on time, so I'm not going to really play these videos, but I'll give you a sense of what we were doing. Early on, I worked with Vicki Colley-Akers, who many of you know, or maybe don't know, but she does, research, and she's now at KU Med. We did storytelling where we interviewed neighborhood community leaders to talk about the kind of challenges they're facing in their community. And they would talk about what's going on, what projects they're working on. And we asked the community leaders to kind of share their perspective. And that approach, we then gave, and we kind of modified a version of photo voice, which many people in public health do. But we did it with video storytelling. We actually turned that over to the community and say, which of these things resonates with you? And we asked the community to kind of watch all these stories and help define what projects did they want to work on. And that's actually helped an organization, Groundwork NRG. They're a neighborhood business revitalization organization, very similar to the Argentine Betterment Corporation that was just mentioned. Groundwork NRG at the time was HMA, and that helped give them some focus for the next few years. So it was stories told by the community, with the community prioritizing which stories and which projects they really wanted to focus on. And so that was sort of my introduction to Wyandotte County, was helping do that project. Another one that at the same time was sort of in parallel was the community wanted a park bench to sit along Jersey Creek Trail. There's a great corridor with very kind of dilapidated park benches and services. And we couldn't quite build the park bench that we thought we wanted to build because our funder, the CDC, said park benches are sedentary behavior. So we worked with the community. It was the New Bethel Church, and Broderick Crawford is a great community leader, but unfortunately is very sick right now. And we came up with a park fitness trail station. And when we installed these with KU architecture students building these, the sound that they made, a resident came out and said, which neighborhood group are you working with? Whoever that is, I want to work with them because we haven't seen anything done in this park in over 30 years. And so one thing we learned is this kind of like identifying what the community already cares about and working with them to make that reality. And even at a small scale, that actually builds capacity for your community partners. Making things tangible, making them real is actually a really powerful thing. Being present with community members, and especially those that are leaders. I've seen so many times in the work I've done over the years is people come in and they think that they're going to solve an issue. And it's oftentimes the case that neighborhood leaders that have been in the neighborhood for 20, 30, 40, even 60 years sometimes have been around and they know what's going on and they know the players and they know the stories. And so I would sit down with resident leaders like Dorothy McField and she'd talk about the food access issues that she was experiencing, the lack of grocery stores in the Northeast area, and just understanding that helps raise the awareness, and you can edify your community leaders, build trust with them, but it's also a way to make sure that that information is available to the next generation of folks who come in trying to solve a problem. That has helped us when we've done things like, working with neighborhood groups like M.E. Pearson Elementary, where we worked with kids because the kids were doing urban farming. We didn't have to recreate the wheel. We just worked with them and did a design project, and that ended up becoming a split log urban farm tool shed, which is up in the top right corner. But that started at a parade on Central Avenue where we were meeting the community where they were. Similar thing with the Dotte Mobile Grocer project, which I'll talk about in a second. We asked community members to engage in participatory budgeting, where they told us what they would do with a mobile grocery store. And we try to just be present as much as we can. And Dotte Agency is sort of still continuing, but it's really in Shannon and Niels's hands. I've sort of stepped away from it because it was never a job for me. So I've done my best to try to find gainful employment. So it's part of the challenge of being a student, right? Is how do we pay the bills and do this work? But just being present is the most important thing I've found in a lot of cases. Trying to help tell histories with community members. I found, and this is sort of alluding to it, these videos so often connecting folks to history and in space. There's a lot of research around the impact of having stories being told in spaces where people can see it. And so this is an example where we went through an active living trails project that we had done with the community. And they were actually telling us stories about bandstands and this WPA bridge and the water that used to be gathered underneath there. And there's just something so powerful about having that ability to understand your built environment and understand how people want to participate in the restoration of it. And so part of that project was actually doing participatory design. We saw signage as a barrier. We didn't have much money, but we had enough to fix the signage. So we put up new signs encouraging people to be physically active. But during our observation, recognizing that the space in a predominantly Black community was also heavily used by the Latino community, we put signs up in both English and Spanish. But we also brought things back like seesaws, and recognizing that when we did the park benches earlier, having white KU architecture students build things wasn't necessarily the right way to go all the time. We engaged with Youth Build KCK, and they actually built park benches that were doubled as a roof joist system for their construction trade skill training with their young people that were from KCK. And so trying to build partnerships and relationships. So it's not always us doing the work, right? There's things that we can hand over to the community that builds their capacity as well. And so being able to tell stories and engage the community and have them be a part of the decision-making process. One of the things we did, and I'll talk about this in a second, was we rolled out a giant map and asked people of all ages to participate. And we asked them, where would you want to see a place to sit, a shady spot, a sidewalk? And that helped us do our design process. And that'll come back in a second. But I think how communities are involved in the decision-making process, that can be a design project. In a similar way, we did that with community health workers years ago to develop the WYCO food map, because we had seen so many food maps that were inaccurate. One food map done by regional partners at the Mid-America Regional Council, they had accidentally included data that was incorrect, where they showed that the Associated Wholesale Grocers, which is a big corporate food chain, has a giant warehouse in Wyandotte County, and it was called a grocery store in the map, saying that, hey, this area is fine. It's not a food desert. Don't worry about it. Well, it's because a grocery wholesaler corporate headquarters was termed a grocery store, but it's because they didn't have people drawing the map who actually knew the neighborhood. And everybody we talked to said, yeah, that's not right. And so we actually worked with community health workers to design the map and put it in different languages. We printed thousands of copies and we made those available to our community health workers just to assist people in finding food, not just grocery stores, but every pantry, every senior mobile site, everything we could find. We also took that a little forward, where we were trying to work with KU Med students and inventorying existing grocery spaces so we could look at how we might encourage some local grocery stores to apply for being WIC certified. It turned out to be a much harder process than we realized, but we were trying to illustrate how space constraints sometimes are what's influencing public health policy. It might be nice to say we're going to get more stores on WIC. Turns out that there's a lot of other issues going into it. We did do photo voice work with community members. That was what the method I mentioned earlier. But I think this whole point is this was all public health and architecture students working together and having it sort of be led by the community in terms of them telling us, okay, here are the things that we're seeing, here are the things that we're working on, here are the things we'd like to see. Those types of stories can have a lot of power, but looking at them from different disciplines actually really helps sort of flesh out the possibilities. Related to that, a grant funder came to us and said, we'd like to see a mobile grocery store. So we developed a shared governance framework with Children's Mercy and a nonprofit called Nourish KC. Unfortunately, Nourish KC eventually fell apart. But we learned that, if it's not by the community or owned by the community, it's not for the community. And that lesson still resonates with me to this day. And so this is a mobile grocery store. It did launch during the pandemic, and it did distribute 120 USDA food boxes a day for almost a full year, which was pretty impressive considering that it's now currently owned and fully operated by residents. It's not on the road right now, but they're looking at a partnership with another nonprofit organization that might get it back on the road here in the new year. But this is what my dissertation is focused on. It's about the decision-making process when there's shared governance, which means people with lived experiences have the decision-making power on the project. And so they've done that through identifying which locations to go to, how the truck was stocked, what food items should be on it, when the community should decide and when they should decide, making principles and sort of vision statements, but also changing policy and bringing sort of a reality to this project. And one of the best things about this process was a moment when we operate on a consensus and consent-based framework, and one of our community members saw that there was a pig on the truck on the initial design idea. And they were deciding which design they wanted. He said, I don't consent to that design. Everybody loved it, but I don't consent. Because he goes, I know I work in the KCK farmers markets, and we work with Somali Bantu farmers. And if they see a pig, they're going to think that the meat's not kosher meats. And if we ever want to carry kosher meats, they're not going to come shop just because they see that graphic. And I do not consent to this design. And that was sort of the first example where somebody said, no, I'm gonna put the brakes on this. And I think that's really powerful because most community engagement in communities does not give that kind of power over. So we, to sit back and talk and work through it, and it was an easy solution, take the pig off, but it was one of those moments where we said, no, we are giving power to the community. Otherwise this design might have gotten through, and nobody would have seen that. So there's a lot of storytelling I could do about that, but that's what my dissertation is focused on. And it's actually about the researching the members who participated in that process, both inside of the community council that we formed and also outside of it, but worked with them to sort of define what are the factors that made the shared governance process work. This is more Niels Gore's work, so I can't speak to it too closely. Just to say that building prototypes where community members can sort of have ownership of it is really important. So in Epic art stage up around 6th and Tormey, I think we've built a park stage where community now uses it regularly for events. And the art walk, we built it, used an old shipping container that's now a art gallery, but originally it was designed to be a small business incubator. And so these were sort of prototype ideas that we gave the community power to to sort of have ownership. And so there is a challenge with maintenance. Anytime you do kind of creative stuff like this, you got to be also planning for the long haul. And that's something we've sort of learned the hard way over time. But it is an important fact that if you do community engagement, who owns this stuff in 3, 4, 5, 10 years? Who owns the website? Who owns the kind of the vision? Who owns the brand? How do you plan for that? It takes a lot of coordination with community members so that they don't feel like the thing that they participated in and gave their effort to somehow got away from them later on. Another project that I'm really happy with how it worked out, and it's still ongoing today, was in those earlier videos I showed you, one of the issues that came up was the lack of sidewalks in the Northeast area. I live in the Northeast area right now, and the community also wanted to work with their young people. And so we developed a process called the sidewalk audit. Is through Come Walk With Us was the name of it, Come Walk With the Sidewalk Audits. And we worked with local organizations, Community Health Council and Groundwork NRG, and the local school, Northwest Middle School at 18th and Parallel, now called Carl Bruce. And the kids did an incredible job, not only inventorying block by block the conditions of their sidewalks, but then also talking about it in a way that was really thoughtful, and sharing about how it made them feel, but also how it motivated them to be involved. And so I'll make sure I share these slides with you all. You can check out the videos yourselves. There's some really good storytelling involved in each of these sort of video vignettes, but it does speak to young people can be involved and they have more voice, more things to say than I think most of us realize. And so connecting them to seniors in the community is a great way to have sort of intergenerational storytelling and being able to sort of build them up and say, hey, you're the leaders of tomorrow. Help us figure out how to do this. So this process is sort of ongoing still. There's 6 neighborhood walking audits that have been completed in the Northeast area of KCK. And they are advocating for more federal capital improvement dollars to fix those sidewalks. A few sidewalks have been repaired, but it's not something surprisingly our city's set up to do. They don't really repair sidewalks normally, they just build new. And so this is part of a larger discussion about infrastructure prioritization. But that whole experience is, how do you train your community members to come up alongside of you? Because if we do community engagement and it's always for our own benefit, we're really missing a great opportunity. And so I've internalized the need to have young people involved in almost everything we do, but also bring the seniors in our community who have this wisdom together. And then the other part of it, and this is sort of getting to my new job, is that, you know, real community engagement takes a long time. You got to be willing to be in it for the long haul. Because what I've learned as projects, and even my current job and my future job, you build up relationships with folks, and then they come back to you when they trust you for the next time. And so this was an example. Last winter, we threw a quick COVID food drive, and we had a lot of community partners show up together to provide vaccinations and testing, but also a lot of free food. But this work was only possible because everybody trusted one another. And the group I manage, the Health Equity Task Force, is who put this on. And so that was sort of a one-off thing. They've been doing one-off things for most of COVID. But today we're doing so many of these because we're coordinating, we're collaborating, we're sharing resources. We have federal reimbursement through COVID response. So we're going to have, I think, what we call them now are neighborhood-based clinic locations. They pop up in community spaces. They were at, we were talking about homelessness earlier. They were at, I think it was the Frank Williams Center serving the homeless population in Wyandotte County, and they had 23 folks vaccinated. Each one got a gift card. We have 42 of these in December alone. And so these are ways to get resources out. We have eyeglass prescriptions, hygiene products, gift card incentives, health screenings, flu shots. We're working on getting culturally appropriate food boxes, I think, the next few months, and bringing these to those areas that are the hardest to reach communities. And so we've mapped out where the highest density of unvaccinated individuals all are, but it's also the areas that have been most, hardest hit with things like social determinants of health and experiencing the sort of systemic disinvestment. And so we're recognizing that there's other things we can do when working with community members, but all of this, every bit of this has been led by the Health Equity Task Force and their community partners who are coming up with these concepts together. And that sometimes it's a little grass tops and not just grassroots. Sometimes you get organizational leadership, but it's still community members who are in the room, who live in these communities, who work in these communities, and they understand what the needs are. And they're trying to meet the needs of the folks that, are struggling the most. How we get the word out is one of the biggest challenges. We haven't done a, huge TV or radio push. What we've heard firsthand is that, especially with Asian American communities and refugee and immigrant populations, you're not going to find that on Channel 2 or on YouTube. Sometimes it's easier to do door-to-door canvassing, personal connections. And so that's what we've invested in, is getting more personal connections, inviting people out, making it more personal, and we distribute calendars. We're also working on a film screening in January. It's not quite finalized, so this poster is not done, but we're looking at having a film screening on Black maternal mortality, again, led by multiple community partners working together to raise issues and awareness about things related to health equity. And the last kind of project I just talked about as a case study is the Health Equity Task Force at large. This is a photo of them setting their priorities for the upcoming year. We meet tomorrow to kind of revise their shared governance framework in terms of how they work together. How do you determine who members are? When do we meet? What's the role of everybody? But then they're out there serving the community. They're engaging youth in the process. And we had a project that's recent called Clean Air Boxes. It's on their website, but it was a project that we were invited to because of being in the community for a long time, these longstanding relationships where we worked with youth at Grant Elementary. We had a local elected official with us. We had the Jenna Club really led the charge, and they built clean air boxes, which can clean the air of COVID-19 through air filters and box fans. And we had neighborhood leaders participating with the kids, and the kids were talking about their experience as a STEM project first and foremost. But now we're working with KCKPS to develop a health equity curriculum that can kind of build upon this as a concept. And I know Jamela, you and I need to talk because there's very similarities to the kind of work you're doing. And so this is just a kind of a brief summary of like what the work looks like now. It's getting out into those neighborhood areas, meeting people where they are, making spaces available and accessible, making sure we're translating things into different languages and inviting different groups to the table. So we're not trying to make this work exclusively about, it's one group or one team getting all the credit. It's all of us together. And then looking at starting to expand into other areas. So things like housing and land use decisions, and how are those equitable? And then the last piece is really starting to look towards the future, but we've had health equity task force members attend op-ed writing workshops to build their capacity to write powerfully about the kind of things that they want to work on, so that their voice is going to have more power in a local newspaper when they can talk about the issues that they care about and their community cares about. And at the health department, we're also looking at a declaration about racism as a public health crisis, which we hope to engage the community with over in the next year, next really few months. But it's going to be an opportunity to kind of put more resources into projects like this.